Today. So, we've been doing this for many years in many countries. So I will never compete with the pharmaceutical company. They're a $1 trillion industry, and they will always find a way, like maybe COVID or something, that to push pharmaceuticals. So we will never just say. So we will never be able to compete, and that is never our intention, is to compete. I come from big pharma. I spent most of my life doing vaccine studies and doing big pharmaceutical work. And there is a place for big pharma. It's a place where there's emergency medicine, where there's surgeries, we need it. And if you even look at some of my trials, we're working with patients on chemo. But this is the issue, and we in third world countries, we need to give the patients a choice. The issue is we are not giving the patients a choice. Would you like to put pharmaceuticals in your body, or would you like to try something that's more natural and plant-based medicine? That is my thing. It's about giving the patient a choice. The other thing is we need to go back to our culture. In Africa, we have a deep root of traditional medicine. For years, we've been using it's called tango. We've been using cannabis for years as a traditional medicine. In India, it's called ban. It's been used for years. We've been westernized. So we need to go back to those roots. The same with the Filipino community. There's cultural aspects of the medicine that we need to use. So I don't want us to get too caught up in this brawl with big pharma. We will too small. We will never be able to compete with big pharma. And I just wanted to add that. Thanks.
Thank you po. My follow-up question, Sir Robin, this is my last question. Since that you are also in the entertainment industry, that you are also into the production, naisip niyo rin po ba na gumawa o bumuo po ng documentation or pelikula na showing how the importance of using and producing this cannabis?
Opo, isa po yan sa pangarap po natin. Katunayan, ayaw po natin gumawa ng hindi po documentary, mas maganda po talaga feature film na may kinalaman po sa medical cannabis. Ang gusto lamang po natin talaga una sa lahat, yung magkaroon po tayo ng maraming doktor na katulad po ng ginawa nila, nagkaroon po ng maraming seminar na mga doktor po natin na pwedeng prescribe na po ng medical cannabis. Bilang paghahanda, kasi po syempre gusto po natin, huwag naman masayang kung ano man po yung gugugol nating panahon o salapi dyan sa pelikula na yan. Dahil siyempre po, dadaan din po yan sa committee natin, sa public information. Gusto din po natin siyempre na pag gumawa po tayo ng mga ganitong proyekto, hindi naman po nasasayang yung pera ng ating mga kababayan. Dahil siyempre po, pera nila yan. Ang gusto muna po natin, ihanda muna po yung ating komunidad bago po tayo gumawa ng public information na pelikula. Maraming salamat po.
All right, thank you. Next question, sir. Please state your name and your publication, please.
Good afternoon, Jonel from Good News Manila. Sir, my question is in light of preparing for all possible scenarios, just in case, worst case scenario, that this effort does not prosper in the Congress or the Senate. Do you have a plan B or what now? What's next?
Ang plan B po, i-refile po natin sa next Congress at 20. Pero meron na po kaming legal na gagawin kasi nagkaroon po ng budget hearing. Nagkaroon po kami ng konting encounter between me and TDB and Senator Coco yata, Senator Coco Pimentel. Na kini-question namin yung DDB tsaka Padilla. Kasi ang nangyari, ang sa batas, susunod tayo kung ano yung ginagawang ng United Nations. Okay. Sila kasi yung nag-aayos kung kung level 1 ka ba o ano ganun. Naglabas ang UN na binago niya na yung marijuana. Hindi na siya ganun. Kumaga, meron na siyang medicinal value. Okay. So, obligado, kung ano yung, kasi sabi sa batas yun, susunod tayo sa United Nations. So, dapat, nagbago din yung bansa natin, di ba? Nagbago din tayo ng pagtingin sa medical cannabis. So, Kung titingnan natin yun, pwede natin dalhin sa korte. Kasi sabi ng batas, merong karapatan ang DBB na sila ang palit. Kung sabihin nila na pwede na. Ganun. Sila hindi na kailangan ng legislation eh. So ang sinasabi natin sa kanila, kung ang sinabi ng United Nations, pwede na yung CBD oil, dapat hindi na tumaan sa firma pa ni Presidente yan. Dapat sundin na natin. So ngayon po, ang hakbang namin is legal na. Kung gusto pa po paabutin pa ng DDP sa imandahan o gano'n, pangit na. Kumbaga, desisyonan nyo na ngayon yan dahil may batas naman. At ang nagsabi po, yung minority floor leader, sinabi sa DBB, alam nyo, dapat sundin nyo si Senator Padilla kasi tama yung sinasabi niya. Dapat gawin nyo na yan. So, sumang-ayon naman po yung DBB. Ang sabi nila, makikipag-coordinate sa opisina namin at sila na po ang magsasabi na yung CBD nga ay dapat hindi na ipagbawal. Ang issue na lang natin ngayon ay yung psychoactive ng cannabis. Yun po.
Thank you very much.
So the United Nations Commission on Narcotic Drugs reclassifies cannabis to recognize the therapeutic uses. So ito po yung sinasabi ni Senator Robin, it happened in December 2, 2020. So signatory po ang Pilipinas dito pero hindi po tayo sumunod.
Good afternoon, everyone. My question is for Mr. Gallo. Is it true that you have a personal experience with medical cannabis? And if so, can you share with us more about your recovery journey and the role of medical cannabis played in your rehabilitation?
Sir, please state your name and the publication.
I'm Ed Uy and I'm a flower from Paris, Ed Uy.
Thank you. I'm very excited to finally get to speak with this. Yes, it is. I do have a personal story with cannabis, and I think it ties everything in. It also brings into the question the gentleman raised about Big Pharma. Hopefully I'll cover all of that. I had a motorcycle accident in 2020 on the 14th of September at 13 minutes past 8 in the morning. There's certain dates and times that you'll never forget. A gentleman did a U-turn in front of me. It was unavoidable. I crashed into the car. I broke my neck. My left hip was dislocated and broken. My left arm was broken. Because of the broken neck, I was obviously paralyzed. Shiksha was on the back of the bike with me, and you go to a very dark place. You know, you're lying on face down on the tar. You're the person that you think, and I think it's quite close to Thailand and other Asian countries. There's a lot of motorcycle accidents. There's a lot of road accidents, and I suddenly found myself being one of those victims. Face down, paralyzed. I thought I was the guy that killed my wife in a motorcycle accident. Can you imagine what a terrible thing that could be? And so it was a long road to recovery. The doctors said to me, look, if you're very, very lucky, you may get out of a wheelchair in 8 months' time. It's a long, painful process. Fortunately, we had fantastic neurosurgeons and orthopedic surgeons. So they put a cage in my neck, they put a pin in my left hip, a plate in my left arm. And they said, look, good luck. There's nothing more we can do. I went into the rehabilitation center, I looked at the doctor, I said, we cannabis people, my wife's a cannabis clinician and I'd like to try medical cannabis as a therapeutic benefit for the pain. And he looked at me like I was mad. His eyes went as big as saucers. And he said to me, do you understand the severity of your injuries? Do you have a TBI, which is a traumatic brain injury from the accident? Because you are trying to do something that's never been done before in a hospital. You're wanting to treat your pain with something that we don't know much about. It's only research-based. I said, let's give it a try. If it fails, then we can go to the conventional opioids. And so this is a very important thing. We use cannabis as a first-line treatment for an incredibly severe injury. Paralysis. I had no function whatsoever. We introduced medical cannabis, not one opioid, not one big pharma drug. It was all stuff that we did using cost-effective laboratories back home that were registered, that were recognized. So we did our own formulations. Shiksha put me on one of her protocols, various degrees. I didn't smoke any cannabis, so I know that's a big concern. It was all topicals. I ingested capsules. We made a thing called the Jello shot, which is introduced sublingually under the tongue. And I walked out of that rehab on crutches in 30 days after they told me that I would only be able to walk if I was very lucky in 8 months' time. Medical cannabis was 80 to 90% of that, and I'm a walking testimony to it. I'm a walking miracle. I've spoken to, the fortunate thing with the meeting with one of the other guys who shared the same kind of injury as well. He bear testimony, so I'm not a once-off kind of miracle man, where I met somebody earlier today, a Filipino, who also, he's been stabbed, he's been shot, he fell out of an airplane, skydiving, he's been in motorcycle accidents, I think you know who I'm talking about. And so we started sharing war stories together. And you'll see that there'll be more and more of these kind of stories as you start legalizing. I think you've seen some of the videos. It's not only from a pain management perspective, it's got a host of other therapeutic benefits. And I'm very excited at the possibility. Let's not overthink it. Let's not be over concerned. It's a safe, effective medicine. I'll be testimony to that. I'm walking proof of that. There are many, many patients, and there are thousands of patients that are now realizing the therapeutic benefits of medical cannabis. And I'm very excited to be able to try and push that agenda forward and have safe, effective medicine for the Filipino population. You guys have an unbelievable opportunity to do things better than the other countries that are surrounding you. I think you must take this opportunity, and I think you can really, really add a lot of difference, not to the Filipino population, but for the whole of the Asian population and the rest of the world as well. You can stand up and really, really take ownership of this, and I'm very excited, and I just hope that we can continue this momentum going forward. I really thank Senator Robin Padilla for all that he's done, him and his team, and the wonderful people that have supported him on the back end, and I hope that you guys will also support them as well.
I just want to add this, because I was treating him, although I was also in the accident, and I was with my drip and dosing myself, and the doctors also allowed me to treat myself. And I had something called rhabdomyolysis, which is crush syndrome, which is also your muscles start releasing toxins, increasing your CK, which is your creatine kinase, which can affect your heart. And so the long story short, I also was treated myself, and the doctor saw the results. But with regards to Wayne, the doctors never seen anything like that with his recovery. They told us they have never seen anything like it. And besides just pain management, the body healed. It helped his bones to heal. It helped him heal from the surgery. And he was the only patient that was so happy in the ward. And every time the other patients, even the doctors and nurses, like, he goes and does all these talks. And like, why is this patient so happy? He can't talk, he can't eat, he can't move, he broke his neck, he broke his hip, he broke his arm, and that is the benefits of healing. So when you're feeling happier, you heal quicker. And that is what I also see in the cancer patients. And I just want you to know, we had such wonderful doctors. Yes, they were doing pharmaceuticals, but now they said, Dr. Gallo, we want you in rehab. We don't want to see our patients leaving rehab as opioid addicts. And that is what I don't want to see. We want to do research with you, and we want to bring medical cannabis into the rehab. It took one brave case of saying, give me the choice. I don't want to leave here opioid addicts. Give me the choice to use cannabis. And yes, we were both very convincing, and yes, the doctors were my friends and they had to listen to me as well, but they were just very open-minded. And I want to take that, and even with the doctors we trained, I'm so glad the Filipino doctors we have, guys. We have really great doctors that are open-minded, compassionate, really, really qualified guys sitting here around the table. Some of the doctors are sitting here, and they have this knowledge to heal. So I'm really excited about the possibilities for healing. Thank you.
All right. Anybody with further questions? Yes, ma'am. Please approach the mic. Introduce yourself and your publication, please.
Good afternoon. I'm Marjorie Uy from 642 and Woman in Digital. I'm actually have a sister-in-law who's having her chemotherapy. Now, my question regards with cannabis is this: in other countries, is this given as an neoadjuvant treatment or palliative treatment for patients with cancers? Now I know that cancer is one of the leading causes of mortality in the Philippines. And my second question is, what is the stand of the Department of Health in regards with medical cannabis? Thank you.
I will just answer the first, and then Senator can answer the second one. So yes, so if you looked at the slides, there is more than enough published clinical evidence. Majority of the countries where cannabis is legal, we are allowed to prescribe medical cannabis with chemotherapy as adjunct treatments. So it's basically been approved for chemo-induced nausea and vomiting because the side effects of chemo are so bad. I'll give you an example. Some of my patients, they go for chemo, and can you believe they go to work afterwards? Wow, because they have medical cannabis. So even the doctors, and what's exciting, even the oncologists now refer patients to us. And if you saw my clinical trial, the research study, not the clinical trial, the research study on prostate cancer, we used chemotherapy as our control group. We also used patients with chemo and cannabis. Remember that graph I showed you? And did you see how well the patients with chemo and cannabis performed? They performed better than patients on chemo only. So it is approved. It is approved in all of the countries where it's legal to use it with chemo. Our country, majority of the patients use it with chemotherapy and radiation as well. Yeah, just to answer, and then you can also.
Marami po kaming ginawang hearing. We made a couple of hearings. Iba't iba, different ang opinion ng ibang tao. Pero ang DOH naman, ang lagi sinasabi, kung ano yung gusto ng tao diba? Kailangan kung ano yung gusto ng tao at kung ano yung inaalaw ng batas. Kumbaga, kung papasa po ito, hindi naman sila magkokontra. Pero hanggat hindi pa siya nakapasa, siyempre hindi sila makakapag-encourage. Pero sa amin pong mga pagdinig, wala po talagang kumontra Wala naman sila. Maliban dun sa mga ibang doktor, na siyempre, nilirespeto naman natin yung mga opinion din ng ibang doktor. Kasi alam naman ng science, ganyan talaga ang science. Mayroong naratibo na pabor, may naratibo na hindi, may research na pabor, may research na hindi. Kasi ang kailangan lang talaga dito, kung sino yung tao, meron siyang karapatan na mamili kung ano yung gusto niyang treatment. Yun naman po yung gusto natin. Kasi kung magiging paligsahan tayo ng research, walang mangyayari. Pero ang katotohanan kasi, iba't iba ang katawan ng tao. Kung ano yung hiyang sa iyo. Kasi katulad po sa akin, ma'am, nakakapag-relate ako sa kanila dahil alam niyo naman, saksakan ko na yapang nung araw kung ano ginagawa kong stand. Ang dami kong bali, may bali sa likod, may bali sa liig, kung ano-ano yung may nasunog. So kung meron talagang isang tao na na-addict dyan sa... Sorry, hindi pa ako nagmura. Excuse me, man. I'm a decent man. Di po, yung Demerol, kasi ako po yun ako ang number 1 tinamaan yan, yung Demerol, kasi ang dami ko nga pong bali, ang dami kong sunog. Hirap na hirap po ako. Kung di pa ako nakulong, hindi ako marirehab Doon na lang ako nalimunagan na siyempre, bilibid na yun. So talaga pong hanggang ngayon po, ang likod ko. Kapag dinala mo sa doktor, sasabihin siya ng doktor, bibigyan ka ng morphine tabs. Yung morphine tablets ko, sabi ko, ayoko na yan, huwag nyo na akong ibalik dyan. So hanggang ngayon po, every 4 hours ako ng paracetamol dahil sa likod ko. So imagine that, ma'am, every day, kung ilan ang iniinom ko na paracetamol para sa likod ko. So yun po sana, no? May iba't iba kasi, iba't iba yung tao. Basta ang alam ko, ang DOH, kung ano yung sasabihin ng batas, susunod siya. At kung sino yung sekretary niya, minsan oo, minsan hindi. Ganun lang po.
In addition, Senator Robin, hindi po ba sa ibang countries they have these clinical trial drugs? Hindi po ba? And when we say cancer, may mga nasa later stage, parang later part of the cancer journey. And then, ito po yung mga parang gagawin lahat to be healed or prolong their life. Is there parang possible and chance na maging, in a way, clinical trial? And who knows, di ba, with the medical cannabis. For those, sabi nyo nga po, kung sino yung gusto, kung willing naman na ang patient to have the medical cannabis treatment, giving hope for patients with cancer.
Ito pala. Sorry. Ito po pala. Sabi pala po ni Secretary Herbosa, passage of medical cannabis bill into law. Ayan pala. Okay. Doon po sa ano po ninyo, yun po yung pinagpapasalamat din natin. No? Ako po, papasalamat ako sa Israel, sa Prague, sa Canada, sa Amerika, na nagpapadala po sila ng kanilang mga evidence-based research. Ano. Kasi po, medyo sa akin po, ano, kailangan natin tanggapin yun, yung mga research na yun. Pero kailangan din natin gumawa ng research natin. Kasi iba yung ating, alam mo, hindi naman tayo puti. Hindi naman, iba yung structure natin, iba, no? So, kailangan, meron din tayo talagang research. Opo. Pero siyempre, kailangan sabay natin. Huwag naman yung, kasi po, meron yung una dati na sinusulong nila, una yung research, tapos humihingi pa ng pera sa gobyerno. Medyo naguluhan ako doon. Pera na naman, pwede bang hiramin muna natin yung research ng iba para hindi na tayo gumastos. Yung sa akin po kasi, kapag naumpisahan natin yung medical cannabis at tumakbo na siya, alam niyo po, hindi natin kailangan ng pondo sa gobyerno. Baka yung economy pa ng medical cannabis ang magbigay ng pondo sa gobyerno. Alam niyo po yung una nating bill na binaya ko sa Spain, yung kanilang medical cannabis nasa loob ng ospital. Ganun din po sa Prague, nasa loob din ng ospital. Kaya lang medyo nabura yung ating unang panukala na yun dahil napunta na po sa talaga kailangan sa pharma. Pero ibig sabihin, hindi po ako tumitigil. Kung ano yung nauuso doon sa mga progresibong bansa, sa mga European o Western countries, sa medical cannabis research, nandun po ako, sumusunod po ako, hindi ako nahuhuli. Kaya nakita niyo po kanina sa video, nandiyan po sa Israel, doon ako sa Prague. Hindi na po ako makapunta sa Amerika dahil ayaw kong bigyan ng visa. Hindi ko alam bakit anong problema sa akin. Why am I not allowed to go to America? I don't know. Siguro po, dagdating ng panahon, makarating din ako doon. So yun po, alam mo, no? Hindi po ako kontra sa kahit anong research. Yung akin lang, umpisahan natin ngayon at gumulong na po siya at kaya niyang suportahan ang research. Hindi natin kailangan ng pera ng gobyerno.
Maraming salamat, Senator Robin. Thank you.
Any addition from our doctors in the Philippines or doctors
I just want to add this. So currently, while there's restricted clinical trials, is in America, cannabis is sitting as Schedule 1 under the DEA. Now, with Trump as president and Robert Kennedy Jr. as health, looking at maybe moving it to a Schedule 3, which will open up for clinical trials. But that doesn't restrict what we wanted to do in Philippines. Already at the Senate, we've already started discussing clinical trials once the legislation's passed. I know there was that doctor who was the surgeon who was head of the drug enforcement, forgot his name, at the Senate.
Dr. Villaroman.
Yes.
Attorney Correg of the OIC for Legal.
Yes. So we were talking about, we were speaking about the problems with methamphetamines and maybe using medical cannabis to look at what we did with opioids as harm reduction. So there's definitely, we should definitely look at clinical trials, and I'm glad, Honorable Senator also supports that, because we want to do it within a Filipino community and see how do certain phenotypes, genotypes, medicine works within this community, like what we're doing in other countries. I know Dr. Gomez can just maybe add there with what we were discussing on trials.
You basically recited our mission statement. Our intention is really to develop this on a research level to fulfill our needs, our market, But like Senator Robin mentioned, initially we have to take baby steps. So initially we're going to import the stuff. Then when we realize how prohibitively expensive these are, then I think the pressure to bring the cost down using our local production might be a good argument. But again, that's an amendment to the law, so this process has taken time. But that's basically what we want to do. Provide for our own needs. Is it like the sugar industry or rice? We're not self-sufficient. So neither are we in terms of cannabis. But
Anything else from our other doctors? Dr. Peter, Dr. Jen?
In the view of the Philippine Society of Cannabinoid Medicine, as healthcare practitioners, we are affirming the dictum of do no harm. But we also believe that we cannot always cure, but we can comfort our patients so that we can improve the quality of their lives despite their diseases that they have, whether they are acute, chronic, or they are terminal. So, as a patient and doctor advocate, we wish to reintroduce cannabis in the armamentarium of safe medications, which will afford our patients with effective alternatives to current treatment and improve the quality of life of our patients. Cannabis, for as long as I've been uh, learning medicine, so it has been taught to us as something illicit or poisonous. So that was the trend of training that we had before. That even if it is classified as an illicit drug, it's nevertheless a drug that we still can use for certain types of medications that current medications cannot give and address their improved or quality of life. So that is that rendering therapy to common ailments like chronic pain. We have taught cannabis. We have been taught cannabis as among our academic responsibilities that we need to know both sides, both the good and the bad of it. So we already know the bad, but we have to emphasize on the good of this plant that we still need as an armamentarium for our for treating our patients. So in my practice, although it's anecdotal, I haven't seen any serious side effects, but I've seen some, especially those referrals coming from going on tour from somewhere, and then they have this naive patients or naive incidences that they were not guided medically on how to use cannabis correctly. So now, because we have been trained and we have given the real world situations on how to use medical cannabis when it will be legal in the Philippines, it will improve our pharmacotherapy, which is not a move backwards because we're going back to plants, but it is actually revitalizing something that has been placed in the darkness for so long a time that we now see that there is light within that plant. So if we can have this plant reintroduced, so we can do better for our patients. Okay.
I'd just like to say maybe a final message, or I don't know if there's a question. But it is really important to consider. There were questions about the side effects earlier. That of course no substance is devoid of side effects. Everything that we put in our bodies will have side effects. It's important to consider that there have been more than 30,000 studies on cannabis. Unfortunately, majority of them is focused on the harm, looking for the harm, researching cannabis as a drug of abuse. That research is not about, it's only until recently where medical studies looking for the medical benefits are being conducted. With that said, almost everything that we know about cannabis side effects is from recreational use. So that's just an important thing to consider, is that under doctor supervision, cannabis is much safer than majority of the drugs in the medicine cabinet. And I would just like to implore our colleague, the other doctors in the Philippines. Unfortunately, mainstream physicians, they only listen to what the industry is spoon feeding them, what the drugs or devices are being under the pipeline of the pharmaceutical industry. So the absence of a medical cannabis industry are making the Filipino doctors ignorant and dismissive and worse, stigmatizing against the patients. So I implore the fellow doctors to examine the evidence carefully, and it will be impossible to deny the medicinal benefits.
All right, do you have another question? Sir, please approach the mic and state your publication.
It's not so much a question, but I'd like to respond to some of the questions. My name is Chuck Manansala. I am the president of Padilla Research. And for the past 4 days, we have conducted seminars through the expertise of Dr. Gallo. And we have discovered a wonderful world of real-life possibilities on how cannabis can be really helpful and improve the health system of the Philippines. But to answer the question of research, we are a research company. Masikhay is a scientific center for the study of medical cannabis. We are tying up with 2 major institutions, and we can assure you that when the law, even before the law is passed, we will start doing some research. We are very thankful for Senator Robin Hood Padilla. I've been doing this since 2014. We have passed the bill in 2019, and we have been able to bring it to the Senate, but hindi umanda. Ngayon, meron tayong kampiyon sa Senado. Sana po suportahan natin ang pag-isipay ng Senator Robin Padilla. Maraming salamat.
All right, thank you so much. Last call for questions. If there are no further questions, may we request, of course, our very own Senator Robin Hood Padilla for his final statement with regards to Senate Bill